You're watching Fairfield Public Access Television, Channel 9. I'm Susan Kessel, the station manager, and Connie Boyer and I are hosting the show Opening Fairfield Doors. Today we're going to open the door of Egli and Nell Egli and visit with them about their lives in Fairfield, their very interesting life, and also what they're doing now and in the future. Connie, our sponsor.
Our sponsor today is a Central Valley Bank. We thank you, Greg and Central Valley Bank, for covering us today. Our mission statement is, by opening the doors of the lives into the people and places of Fairfield, we will strive to promote awareness, appreciation, and understanding of one another. And today we're really, really excited because we're going to go to another continent today. We got some slides that Egli and Nell are going to show. But before we get there, let's talk a little bit about their life in Fairfield. They've been here for many years, and I grew up in their house a little bit myself, growing up with daughters. So I have a lot of fond feelings about this family. And so, Jean, can you tell us a little bit about, how long you've been here? And you've been a doctor at the Medical Arts Clinic for many years.
Right. Well, we've been in Fairfield about 38 years. I've been retired about 9 years, although I've seemed like I keep working, doing something. But we were at the Medical Arts Clinic for 30 years about. And we've been going to Africa. So this will be our 8th trip. We're getting ready to leave again.
And you've been doing this just since retirement?
Yes, yes. When you work really hard every day in the office, when you take a few days off, you sort of would like to go play golf or something. But so after retirement, I still like to work, and so I found a place to go.
That's great.
Now, in the community, both have been very active. I know in the arts, you're a wonderful cook. I know that for years you have the reputation of being a wonderful cook.
Well, thank you. We get by, and Nell's a very good cook too, and we just sort of enjoy that. It's something that it's completely different from medicine. And you like a little, and I like to go to the grocery store and do things.
I do remember. I don't know how many years ago, but you were on the cover of, I believe it was Picture magazine. With the Des Moines Register, and you had a wonderful spread of all this artistic-looking food.
Yeah, that's a long time ago. But we still like to cook, but we've drawn in a little bit. We don't go quite as big now as we used to.
And now I know that you've been very active in the community also, in different organizations and.
Well, I will mention, since you're so active in the Art Association, that we were in the group that started it.
The founding members.
Yes,
Yes.
I was the first secretary, and look where it is now.
Right, right. And you have 4 daughters?
4.
And they are?
We have 2 in Minneapolis, Suzanne and Carol. And then we have 1 in Ames, and she's the only one that's following her dad's work, and she's a physician's assistant.
Okay.
And she's working at a big clinic up there. And we have another daughter in Atlanta, and she's an attorney. So when we have to drive quite a little ways to see our kids, but the roads are good now. So.
Suzanne was in some commercials, I believe I've seen.
Yeah,
Yes.
she's an actress, and she was on Hometown for a couple of years on public television. And then she's done quite a few commercial work and industrial filming. That's what her main thing is.
And you still see an occasional rerun of hers, they'll be like on the Learning Channel or something like that. It seems like they just continue to rerun those.
Actually, I got a hold of one, I believe it's on asthma, and I ran it, and I still have it. Yes. So once in a while, you might see her on there for that one.
Century 21 shows her. She's showing how to get your house ready for sale. And someone watched it here in Fairfield and said, "Oh, There's Susie. They didn't know Susie because she'd been gone so long.
Right, right. And you've been very active in theater yourself, behind
the scenes only, painting and sewing,
props
mostly costuming.
Okay.
Because I like to sew.
So now you've got a new area in your life. How in the world did you get started doing this?
Well, you know, I worked very hard at the clinic, and I didn't slow down one bit. I just, on Friday, I was finished. I had a big full schedule all day long, and finished. Well, at first you sort of think, when you retire, you sort of think you're on vacation. You know, you don't think, well, you're going to be going back to work. But after a while, you start realizing, no, I'm not on vacation. I'm retired. And so on, and it's very hard to do. For, you know, I'm not a very good golfer. I do like to play golf, but not a great golfer. Don't fish, and so on. So I start looking around. We wanted some place to go so we could do a little work, you know, keep your sanity. So and you know, when you look for a place, it's a little more difficult than you might think. I mean, started calling here and calling there, and finally we did find this place in Africa, in Ghana, where we could go. And that really was a great help in making an adjustment from work to retirement. So went over there and worked. We'd see a lot of patients. We go to a town. It's a city, a very large city, where there's a clinic staffed by nurses. And then when I come, of course, sometimes they just gladly turn over the work to me for a while, or we talk back and forth, and we try to improve their skills. And then we do some educational work, like training primary care workers. You know, there's only one doctor for about 35,000 Africans. And really there's a tremendous need, and mostly they go without medical care. So you can do quite a bit. I could teach you to take care of malaria in probably 20 minutes. But it's not quite that simple, but at least I could tell you something about how to go about treating some of those diseases and stuff. So we liked it over there, and we seemed like I will say this, that the first time that we went, you know, you're always kind of glad to get on the plane and
come
start for home. And we go to Amsterdam, and when you get on the plane, you hope that you don't have to turn around and go back for some reason or other, or you don't have to take some alternate city or something. Well, so when we got into Amsterdam, I was walking, you know, out of the plane, and I turned to Nell and I said, I will never set foot on the continent of Africa again.
This was the first time?
Yeah.
First time.
Yeah, and Nell said, that goes for me too. So we've been there 7 times.
I was going to say, Nell, what did you think about the prospect of his...
Oh, I think it was great. Oh, I was all for it.
Now, are you a nurse?
No.
No?
No.
Okay.
So what are your
No.
what are your activities when he's working?
Well, I don't do too much, but when we go out in the village, see, not only does he work in a clinic in the town, then we go out on mobile clinic, they call them. We take a van out loaded with medicine and a table and a few chairs, and you go out into a village where they have no medical care at all, and set up under a mango tree, a table and a chair and a stethoscope and the doctor, and then you've got a medical clinic. And I count pills. He says put 10 in there. I put 10 pills in a little envelope. I'm the pharmacist. I come back and tell the pharmacist here, no problem being a pharmacist. And I pour medicine out of a big jug into their jugs, because we can't provide bottles. So our patient has to bring their own bottle that they get from somewhere. They sell old bottles. You don't throw away anything over there. And they bring it, and I can measure, 10 cc's in here.
You might, like it might be a soft drink bottle or something.
Ketchup bottle.
And you're only going to put in maybe a half a cup, and it's a good sized bottle, but that's all that's all you have, so that's what you have to use. And you hope it's clean, and you look it over, and sometimes we have people, and like at the clinic, we have a lady that does nothing but wash bottles they bring in. They wash them, and if they don't bring a bottle, they have to pay for that bottle because it costs money.
It's hard to come by.
So regardless of, just a nasty, it's not like going to the drugstore and getting a nice, proper sized bottle and all that. It just doesn't happen. But Nell, another thing Nell does is we give eggs to families. When we show slides, I'll show you this a kid that is suffering from a disease called Kwashiorkor, and he's very short on protein. And eggs are a very good source of good high quality protein. So we boil up some eggs, and we'll send 7 eggs home with him so he can have an egg every day. And you'd be surprised how much better they are when they get back. So and sometimes I'll have medicine over at the house that I don't bring over to the clinic, and I'll send a prescription over to Nell, and she takes care of that.
See, we live very close. It's just almost touching the clinic and the house. We live in a compound that's surrounded by a wall, and so he can be there in 1 minute. So that's what I do.
Every once in a while, I think that it would be really neat, what a word, gratifying to go do something like this someday. Did you always think about this?
Well, mostly, when you're working, you just work, and you don't think too much. But when you have time, and for instance, we're both healthy, take no medicines, and you feel like you have this knowledge, and it's sort of going to waste, and so that's one thing that gives you an incentive to do that. And of course, there's a little bit of risk in everything you do and all, but it's not a high risk, and it's something that you do. It's a good experience. I'll say I don't like to say that we enjoy it, although we actually do enjoy some of it because you make a lot of friends and so on. That's one thing about going. When you go over there, you make friends. Okay, so they start writing you letters. Come back, and then you like to go back because you see friends and stuff, and you know that you can be helpful, and it gives us something to do.
Well, I know there are things in my life that I don't really enjoy doing them. Help put on a kid's retreat or something.
Yes.
You just kind of almost dread it.
Yes.
But then you do it, and it's so rewarding, and you are able to do something.
Is that what drew you back the second time? I mean, what really drew you back the second time after you had said, I don't want to ever go there again?
One thing...
I will say, it's like, I say this, it's like having a baby. The minute that, while you're in labor, you say, I'll never have another baby as long as I live. And the minute the baby's born and you see it, you say, maybe I will. And then you forget all about it. And so we forget how hot it is and how we get really hungry for beef and how the eggs taste a little funny. And you forget all that and you just think about, how nice it was and how wonderful to have fresh pineapple every day and pawpaws and bananas picked right off the tree, and what good friends you make and how much good you're doing and how you are helping and all that. You forget about the rougher times.
And then you have people that are there all the time, like a nurse. She probably spent 5 years in Africa, and you know that she likes to have some help, and so you go over there to support them and support some of them are just full-time missionaries in other ways, and it's just to support the people that are over there, and then and do the work that give them a little relief so you can fill in, and then you do improve their skills sometimes too.
Now, how long a time do you spend there actually? What length
We usually
of stay?
spend 2 to 3 months. We're going over for 3 months this time, and
But never again.
But, well, it probably would be our last time, you know.
Yes, I know you recently decided that you are going
Yes.
back.
Well, we're going next Monday. We're out of here. We're heading.
3 days.
Yes, and you know, all that stuff in the dining room there. We're getting packed and ready to go.
Well, maybe we'll take a look at that. But first, maybe this would be a good time to stop and reset the camera, and we'll take a look at some slides.
So this shows we're getting ready to go. We're at the airport, and you notice we have a lot of luggage. And we got a lot of medicines in there. We have clothing, but we hope when we come back that we'll only maybe have some of those bags we'll just leave over there, and some we hope we don't bring back more than about one, and we'll travel very light coming back. And we get into, this happens to be Ghana, West Africa, and this on the right-hand side is the clinic, and on the left-hand side is, as we call it, a compound, and we live in that house on the left. So it's very handy. You see it's very dry. We usually go in the winter time, and it's the dry season. We don't like to go in the wet season because the roads are very bad, and then you have an awful lot of insects also. So this is the group that runs the clinic. These are primary care workers, and we have one nurse standing next to me on my right. And every morning we have patients come in, and they're interviewed by the people that we're seeing, and then they will come in and see me. And I'll have an interpreter, of course, because there are 49 languages and dialects in Ghana, and obviously I can't learn one of them, let alone 49. And these are some of the people out in the waiting room. And this just happens to be happens to be Nigeria. That's where we're going. And you notice the difference, the colorful costumes that they have. And so this is a typical setting. Now, this nurse, normally when she runs the clinic, and she has an interpreter, the lady in the pink in the background, and then this little child is not doing very well because it's not getting enough protein. And if you notice, the mother is pregnant, you see, and so she had to wean the baby because she's going to have another baby. And so that little child is not getting very much protein. And in Africa, sometimes you have to sort of fight for what you get. You may be sitting around a large bowl, everybody dips in there, and the older ones, they sort of push out the little baby sometime. So we will do some things that will help this child, and I'm going to show you the next slide, which now this child is further advanced into a disease called Kwashiorkor. That's the protein deficiency disease. If this child is, if we don't do something for this child, it'd probably be very seriously or possibly dead within a week. You notice the legs are swollen, the child is irritable. So what we'll do is we'll give them some vitamins, and we'll talk to the mother about nutrition. You notice she's also pregnant again. And then we will send home some eggs. Nell does this program, and she'll boil up, has some eggs boiled, and we'll send over to the house, you know, just a little ways from us, and send along 7 eggs. We'll see the child in a week. We'll tell Mama what to do, and then we'll see the child in a week. And you'd be surprised that sometimes that child will just look like a different person.
Now I have to ask a question, since two of the women were pregnant. Obviously, that happens a lot.
Yes.
Do they use birth control? Do you promote that?
It's promoted, but it isn't practiced. Very little of that. It's the culture. It's a long story, and it's the culture, and they just don't do it. This lady, you notice if you look at her left leg, she has what's known as Elephantiasis, because it looks like an elephant's leg. And it's caused by a parasite that gets into her drainage system, and plugs it up. And we're able to kill the parasite, but we can't undo the damage that's already been done. And this is a fairly common disease in Africa. This is, of course, a very large goiter. And you notice, can you imagine carrying a goiter around that large? And if you look at the patient, her eyes are sort of buggy. She's getting too much thyroid. And there's a few things we can do for this patient. She needs to have that removed.
Do we see this kind of problem in the United States? I've never seen anybody that looks like this.
They wouldn't let it go near that long. In other words, when somebody comes into my office with a little enlargement of their neck, you know, where the thyroid is, I know there's something wrong. I send them over for tests and so on. And if they have hyperthyroidism, we'll have a treatment for it. Surgery is done only like in cases like this where it's so huge, you know, you need to have that removed so you can breathe better.
Do you know if surgery was done?
Yes, some surgery was done. I saw that lady a year later, and it wasn't done quite like we do it here. They didn't take the whole thing. Of course, you have to be concerned about whether the patient's going to be able to tolerate the operation, and the facilities are not very good, and so on. So, but she did have most of that removed. Here's a setting. When I go to Africa, of course, we can't speak the language. You have to have the interpreter who's in the back. And these children come in. They're usually fairly easy to work with. Some of them have never seen a white person. There are not very many white people in Ghana. But you'd be surprised to notice how easy it is for me to examine that patient. We see some diseases. Of course, the main disease in Africa would be malaria. And we have never, most of you have never seen the disease in the United States, and only people that go to foreign countries might come back with malaria, but doctors don't see it either. And it's like leprosy. I've heard about leprosy. And I was almost 70 years old before I ever saw a case of leprosy, but this is one of them.
And how do you treat that?
Yes, we will refer this case to the World Health Organization. And you have what's known as a multiple drug therapy. There's a very good treatment for it. And you can see this is fairly far advanced. And you notice the foot is, all the toes are gone, and if you go up the foot and up toward the leg a ways, that's the hand. So the hand, now this patient probably could have gotten to somebody much quicker, although it's such a big problem. Transportation is a big problem. They have to walk wherever they're going as a rule. And so there's communication and transportation and education. They're all very lax, and that's why this patient has not had care a long time before. But see, they hear that a white doctor is coming to the village, and so the word gets around. It's surprising, word just goes like that. Of course, when they see me come into town, well, the word goes very fast, and the longer you stay, the more people come to see you. I just wanted to show in the clinic, this is a pharmacy, and it might look like there's quite a bit of medicines up there, but it's really not very many. And we did, when I first came there, that was all brown, it didn't look good, and I said, let's paint that white and make it at least look better. And the man on the left, he dispenses most of the medicine. He is not a pharmacist by any means, but he has had quite a bit of training in medicine. And I can write on a prescription Chloroquine. That's a treatment for malaria, and he will see the child. He knows how big it is, what the dosage should be, and that's all I have to do. Because I don't have time to do a lot of writing. I have to roll along, I have seen as many as 100 patients in one day, and that's quite a few for an old man. Now, I just wanted to show you that I call this a fast food place, or you could call it a convenience store. That's right outside our compound, and you can buy quite a few different things there, and the neighbors we'll come over there and buy maybe some eggs and some oranges and oil and so on. And this is another little fast food place. You know, that it's very big problem to get breakfast, for instance. You know, you have to go out and build a fire. The stoves are outside, and all they are is like a bonfire. So you have to go out and start a fire, boil rice for so long, and so on. And so it's cheaper for them to come in and buy from this little fast food place. And you notice that it's very clean because the lady is sweeping the ground. They sweep everything up, the leaves up, and all. It looks.
A question: what do you eat when you're there?
Well, first of all, we eat quite a bit of imported food, we'll say, but we also eat rice. You know, we can get rice, we can get tomatoes, and when we're going to get to a market pretty quick, and I'll show you some of the things that we can eat. But we have to be very careful. If you know, I do not like to be sick. I can't afford to take off time to be sick, so I have to be extremely careful. If you're not careful when you're in a third world country, you're going to be sick for sure. And you not only sick, you can be worse than that. And this is where I was giving lectures to primary care workers, trying to explain diseases, what to expect when they're out in a village, because they're the nearest thing to a doctor out there, and they have very little training. Now, Susie, here I was talking about birth control to people, and you have a pretty tough time selling birth control, I will tell you.
To the men, not to the women.
And this is in the clinic, and we have the patient is in the white shirt, and then the fellows in the background are in our class, the medical primary care workers. And I try to explain how to go about talking to a patient, how to examine a patient, and how to make a diagnosis. And they can get a lot of diseases that they can treat. And I just want to show you the roads can be a little bit of a problem, and especially when it's wet. And as we go out into the village, you notice there's a hard surface road on the left, and it looks pretty good, but you might go down the roadways and there'll be a pothole that'll be so big you can practically hide in it. And but along the way there's going to be somebody selling something, and these bananas are so good. They're ripened right on the tree, and they're very cheap. And when the one village that I go to quite a bit is called 14 Mile Village, because it's 14 miles from the main highway. And this is going out through the bush, and this road may look good, but I can tell you that it's a lot worse than it looks. And then you'll have a bridge along the way, and those bridges are so rickety that you just worry a little bit if you're going to make it across. And then as they get out to the village, here's what it looks like as they come over the hill, and you can see that it's not a very fancy place. About 2,000 people live here. And the first thing you have to do is you have to go to see the chief. The chief is in charge, or he's sometimes called the king, and so you have to talk to and see if it's all right for you to stay there, if it's all right for you to work. And when he says, you are welcome, you feel very comfortable. And this is the primary care worker's office and the pharmacy. Doesn't look very fancy, but he does a lot of good work here. And there we are sitting down. These are medicines that I brought along, a lot of them. And you notice now, she doesn't understand a word I'm saying, and I don't understand anything. Oops, sorry. But you know, there is some communication there. And of course, I have an interpreter, you know, too. But, and you have to look at a patient. You know, I tell my students, you know, that when you see somebody coming in, why, you should be able to look at that patient and see a lot and think a lot about why that patient is coming in to see you.
I imagine also just with hand signals, you know, stomach,
Yeah.
whatever, that you can get a good clue on what they're
Right.
trying to tell you?
Yes, it is very helpful. Yeah. Now, one year we took along a young doctor, and he had that as part of his training, and here he's examining a baby. And this is the situation again. The interpreter's over there, and the old gentleman, I guess I would say the old gentleman is me, and the younger man is a patient. And when we go out into the village, the little kids, you know, some of them are dressed, they've been going to school, some of them don't have the uniform, some of them can't afford it, and others are not even going to school. But they see us coming in, and you know, it's the first time they've seen a vehicle maybe in 2 weeks, because there's no vehicles in that village that are owned by any of the villagers. And then here's a white man sitting up in there, and if Nell's along, that big white here, you know, they see something is different. So the first thing I do is I go out and I try to put my hand out and see if they'll touch it, and sometimes the little kids will pull back, but the older ones will come out and start slapping my hand. I go around and they know that I'm in town and we'll be working. And there's one well in that village. And in many villages there's no well at all, and they may have to walk several miles for water. But this is a well. And here you see, toward evening, this young lady came down to the well to get water. It looks like about 4 or 5 gallons, and water weighs 8 pounds per gallon. And she picked that up and put it on her head and walked off with it. And of course, I wanted to get a picture of her, but all the kids jumped in there. They just love to have their picture taken. And this gives you some idea. Here's a little girl carrying her sister or brother. You can see they're not real healthy. Most of them have parasites. They have malaria several times a year. They do not have good nutrition. And the little packages, the brown packages back there, are food. And I don't have time to tell you a lot about it, but that lady there is selling that Kenkey, it's called. And this is part of the market in that village. And you notice they don't have very much to sell. They look like they're not very well off. And this, in the evening, they make fufu. That's a food, let's just call it mashed potatoes. It's not potatoes, but it's a mixture, and they have to pound it. They pound it in a mortar and pestle. And that's something that expatriates like myself do not eat, because it's handled too much. And also the pestle is not real clean. And when I look out my window, this is what I see. This is these are houses. And then sometimes I'll stay out there 2 or 3 days, and somebody has brought me out, dropped me off, and then they go back, and then they come back when I tell them to come back. So like I'll tell them to come back maybe 12 o'clock on Friday. And when that vehicle comes in town, everybody runs to see, and the old doctor is ready to go home.
Is there any communication? No telephone, no.
No.
I mean,
there's no telephone, no electricity,
Cell
no telephone. We have a little radio, but I usually don't take it out there. It's a shortwave radio. We get Voice of America and we get BBC, but for the most part, and the newspapers, they wouldn't. They couldn't read a newspaper to start with because it's in English. English is the official language of Ghana, where we have gone many times, and to Nigeria, where we will be going. It's the official language. So papers are mostly in English, and only about 10% of the people can speak it.
In this particular village, how many people live there again?
2,000.
2,000. And so is there a school then for the kids to go to?
There's a school, but first of all, they don't have to go, and some of them don't go because of that. Some of them don't. There's a little charge and so on, and it's surprising how many will not go to school. And then if they go to school, it's only for a short time, and then they just drop out.
Would they be taught English in this school?
Yes, but not as much as I think they should. Because, you know, if you don't have a language, it's very hard to have a country. So, I think, how's our time running? We're, I wanted to show this picture because a few people that know me, and Susan and Connie mentioned something about it that we like to cook. And you know, you notice I'm pretty happy because I'm I'm at the grocery store. This is a market not too far from our place, and they bring in things that are raised there. And in the back you'll see beans, and you'll see rice and tomatoes and onions, and down in the background on the right-hand side there's some little red peppers, and underneath it are yams. The yams are not like our yams at all, and we don't eat very many of them, but we eat some. They're not very tasty, but we love to go to the market. And if you want a dozen eggs, why, you can find them. And if you need shoes and eggs together, why, the same person is selling shoes and eggs. And those eggs will sit out in the sun. They'll actually keep for a long time. They'll keep maybe up to 30 days. This is a fish market. That's downwind from the rest of the market. And
Nell, you look real happy.
That's a grass cutter.
She's not happy because she found something that we're going to eat. This is what's called a grass cutter, and everything.
Not a lawnmower.
And they eat grass, but it's a rodent, and of course you see the intestines have been taken out, and it's been dried, and they bring it to the market, and it'll sell for quite a bit of money as far as Ghanaians are concerned.
Did you want to be a vegetarian after that?
Nothing is thrown away. You know, even though we don't see the rest of the grass cutter, but it was eaten. And here are a bunch of yams at a market. And I call this Walmart. You can buy about anything in there. And there they're making fufu again. And see, the mom has a baby. She has a little pan of water sitting beside her, and when he raises up, she gets in there and turns that fufu over, and then he comes down again. If you don't get your hand out of there, you're in trouble. And one time, you know, I thought, well, it'd be kind of fun to, you know, I'd do a little of the chop. But the lady didn't let me do it very long. She was afraid I was going to get her hand. Well, here's a couple of kids way out in the bush. I mean, and you know what they're doing? They're out there looking for food. And you know what kind of food they're looking for? If it flies and is not an airplane, they will eat it.
Sounds like my husband.
It has 4 legs.
If it has 4 legs and it's not a table, they eat it. And of course you eat it when you're hungry. So they might shoot the prettiest bird in the country because they're hungry. They got to eat something. And I can tell you that little boy can take that slingshot. He can hit the eye out of a bird every now and then. Well, this is we're getting pretty long, maybe.
I think we're okay.
Are we? Okay, I'll keep running. I'll run along. This is a village we go to. See, these kids are thin. They're, you can see their knees. Like I say, they have parasites. They don't get good nutrition. Probably had malaria several times. And the little boy is carrying a baby on his back.
I was going to ask about the clothing. In the other pictures, a lot of the clothing looks like what we have here.
Yes.
Do they get it from donate?
A lot of it is donated, but I tell you, countries send used clothing to Africa, and most of it's resold. So they use their native costumes, some, but more and more it's being westernized. I hope I can. Now, this is a guinea worm, And this worm has been in the body for quite a while, and it comes out down at the foot. And I'm not going to go into a long, because it's a very long story, but anyway, this person has a guinea worm, and it's uncomfortable, and they wrap it up on a stick and just wrap it up a little bit every day, and eventually all the 2 to 3 feet of that worm will be drawn out. And here's where they get guinea worm. They go into, see, these people probably have walked maybe a mile, maybe more, to get their water. They go down in the evening and they get water. And they go into the water. If they have a guinea worm on their foot, why, it lays its eggs, and then they scoop it up, comes back, and it's spread around the village. You see, Nell draws a crowd. It's going way out.
Out on a limb.
I mean, yeah. No white person has ever been to this village before. And Nell's doing a little teaching there. I wanted to show this picture because the women work so hard. She's got a baby in the back, load on her head, and believe me, it's hard work. Oh, I'm glad I got to show this picture. And even the little boy, see, he has a load on his head.
So that's a real load.
That's right.
Yes.
That's right. And no telling how far they had to walk. And Nell made some dolls for the kids. It's a little hard to see them, but anyway, those are rag dolls. There's some beautiful flowers in Africa, but not enough. Well, we're getting into a different country. We went to the Dominican Republic once, and it was so much fun. We sat in the kitchen and saw anybody that wanted to come in there. I wanted to show you this. You know, we were in the house, see the cat sitting in my bag. I turned around, there was that cat perched up there sleeping in the bag. Well, is that enough?
Yeah, I think we'll take a camera break from the slides.
We're now in the living room of Nell and Jean Egli, and one thing we want to mention before
This is the dining room.
Oh, yeah, what did I say? Living room? See, that's where we can't edit when you screw up like that. But before we get to all the stuff that's laying around, getting ready for the trip, we want to talk about her dress from Nigeria. And was this given to you as a gift?
It was given to me as a gift. And my bracelets from Ghana, they're Ashanti beads, which are very well known in Africa. And they were given as a gift. The person who gave me these said these were much finer than these. And you see there is a difference. I've never seen these ever before. I've seen lots of these, but they are strictly Ghanaian. But the dress is Nigerian.
And even her shoes are native shoes, you might say.
Yeah, they're from Ghana. Very uncomfortable, but it's what we wear in Africa because it's cool.
She's suffering today for us.
But they're cool.
Right.
When it's 95 degrees, you wear thongs.
So can you tell us a little bit about what you take with you when you go and how you prepare?
Well, we take quite a bit of medicines, mostly medicines that are hard to get in Africa, and medicines that will treat some conditions that can be treated over a short period of time. That is, like if you have an eye infection or something, if we have the proper medicines, we can treat that. But they cannot afford really expensive medicines. If we start them on something that they're going to have to use over the years, we don't start them on some of the medicines that we're using in the United States because, first of all, it's not available, or if it is available, it's very expensive. So we have to use what we have.
Now, are they paying for your medical attention?
No. For the most part, it's strictly charitable, except to say that sometimes they'll make a little bit of a charge, I mean, just a nominal like 10 cents or something like that, because if you don't, why, everybody in the village just lines up. And you just can't see them all. And not only that, the ones that are not sick, they will come in too. And maybe there's a very sick child, the 500th in the line or something like that. So you have to do something to try to cull down a little bit, and that's one way we do it.
Now, the organization that you're hooked up with, what's the name of that again?
It's an International Healthcare Foundation. It's just a private organization that takes donations from people, and they support hospitals in Africa a lot, and in South America and around the country, around the world.
Do they provide you money when medicines to go on this trip?
No, they don't. Being a short-term medical person, we pay our own way, but friends of ours help buy medicines, and that helps an awful lot. And then when we get over there, of course they have certain medicines there, and that we can use too. But the medicine that you see strung out here, and a lot of them we already got packed and so on, and they are purchased by an organization called Blessings International. It's in Tulsa, Oklahoma, and we can buy them much cheaper there.
So all of the luggage that you're taking is containing mostly medicine.
Medicine and
a layer of medicine.
Yeah, we have to take enough clothing, of course, obviously, to get along, but it's clothing that we're going to leave there mostly.
So what are some of the things that you will take with you that you'll use a lot of?
Yeah. Well, the thing we'll use most of is chloroquine, but we're not taking that along because it's available over there. And then parasite medicine, and that's available over there too. But like here, for instance, is an eardrop, and it's hard to get over there, and it'd be rather expensive also. So every mom had kids that rupture their eardrum and so on, and if they come into me, sometimes they've had a draining ear maybe for several months, and we'll put them on some antibiotics and give them an eardrop, and a lot of times that ear will heal. And eye drops, the same thing. There's some very serious eye problems, and the medical care is just not very readily available, and also the medicine is not readily available, and many times you can't afford it. Remember that a patient has to walk to the doctor as a rule, and that gets to be quite a problem.
Now, under the, you said eye problems, you are also taking a supply of glasses.
Oh, yeah.
Take just magnifying reading glasses, and I was able to buy a whole bunch of them down in the other parts for $40 a pair, and people have given us money to pay for them because they usually. So he gave me a good price.
They're reading glasses.
Just reading glasses, and that's one thing I can do, because I'll just put it on someone, hold up a chart or something for them to read. Then until we discovered they can't read, so we had to get something with little pictures, and which picture is clearer. And so you keep trying. We have about 4 different strengths, and I don't think anyone's ever taken a pair that they didn't need. We have had some people, they keep on and nothing helps. And they'll say, instead of just taking it, they'll say, no, it doesn't help. And so obviously something bad is wrong with their eyes, and we can't do anything about it.
I imagine you are like miracle workers when you go there.
Oh, absolutely. When you put a pair of reading glasses on someone who didn't know that the tree had leaves,
you touched on something that's interesting. Like if you're not careful, people like if you're giving out medicine, they'll take it, and they'll sell it to somebody else or something like that. You have to be a little careful, and so you try to make sure that you're seeing the patient that needs that medicine, and that if they need it, they're going to use it. But somebody that doesn't need it, if they come in, they'll just take the medicine. If you're giving it out without any strings attached, they'll take it, they'll sell it. They might sell 3 capsules to somebody, 3 to somebody else, and I mean they don't know how to treat the disease, and it's just not a very good thing.
Problem.
Yeah.
Now, is there any kind of dental
Yes.
problems that you
Plenty.
deal with? I mean, here we're
Plenty.
dealing with eyes when you're not
Yeah.
specifically an eye doctor. but,
Dentists are very few and far between. And dentistry in Africa, for the most part, is pulling teeth. And I do not know how to pull a tooth properly, except a kid's tooth or something like that. But I have seen abscesses, and of course we can use antibiotics, and also we can do an incision and drainage, which we do some. But there's plenty of, but you'd be surprised, their teeth, some of them have the most beautiful teeth. I just love the teeth. You know, they're white and big and sitting out there, you know, and they don't eat, they get virtually no candy. And they brush their teeth with a chewing stick. They'll take a stick and they just start, it's a certain kind of wood. They start chewing on it, and then after a while it looks like kind of a brush. And every morning, they're just working on that.
So that is something they do.
Yes, a lot of people brush their teeth with a chewing stick, and they can't afford a toothbrush. There's no use sending toothbrushes over to Africa. They can't because they can't afford to buy the dental cream to start with, and they can't find it furthermore. So you'd be doing something that wouldn't be helpful. You know, there's certain things.
I'm sure there are a lot of things that we think up that we think we should do that when you get there are totally not appropriate.
That's exactly right, and that's you know, I will not take, like for instance, as I told you, I will not take along a blood pressure pill that costs $1 a day. There's a lot of them cost more than that, but first of all, it's not available, and they couldn't afford it if it was. After I leave, what good does it do them if I treat them for give them enough pills to last them a month? It's all over.
The same with like insulin. It has to be refrigerated. And you don't have electricity. You don't take out of the village, you don't give anyone medicine that has to be refrigerated.
Well, you saw the housing, some of it, and so you know that there's no refrigeration there.
We're hoping our house has refrigeration. The last time we were in Nigeria, it never got cold. We never had ice. It never got cold enough to freeze ice. It never got cold enough to keep milk cold. So we're hoping this time maybe the electricity will be a little better. At least you really miss having something cold to drink when the temperature is 90-something.
Yeah.
That's really.
You know, I'm getting
How
kind
much you appreciate your own refrigerator.
Yes.
I'm getting kind of hungry myself. But I'll tell you one thing that one side effect of the African trip, which is desirable, is I hope to lose 10 pounds. Not that I'll be suffering any, but you know, we won't be eating we won't get any ice cream. I don't expect to get a spoonful of ice cream while we're over there,
And you'll be walking.
Yeah, we will walk more than usual. However, we do have it's called an ambulance at the hospital, and they will take us around some, you know, when we want to go to the village or something like that. But if when I call it an ambulance, it's like well, I can't think of an analogy, but anyway, it's not very fancy.
The vehicles, you can't describe the roads because no one here has ever seen anything like that, you know. But no, but this is the first time we'll ever have lived in a village. We usually live in a town and we go out to the villages. This time the hospital is out in the bush. And the house that we will live in is by the hospital, so we'll be strictly in the bush. And so someone will have to take us to the town, which will take probably about an hour drive there, and then it takes a long time to go to market, because you go here for a little flour, and here for a little rice, and here for your thing. But out there we'll also have, people will probably bring things they always have, like bananas, oranges, pineapple, plantain, pawpaw, that's papaya, mangoes. And the last time we were at this same place, somebody brought us a basket, 23 avocados right off the tree, fresh. They taste so good, tree-ripened avocado. So
I am getting hungry.
We look forward to that. So it's not all hardship. If you could eat vine-ripened pineapple every day, makes it worthwhile.
Now, since you're staying there for 3 months, are your friends here in Fairfield able to communicate with you? Is it worth sending a letter over there? Will it get to you in time, or do we have to send it like the day you leave?
Well, Nan never told me she's already written me.
It takes 2 to 3 weeks.
2 to 3 weeks.
2 to
at
3
least,
weeks.
Right.
So write
So
there is cards
time.
and letters
There's time to
now.
write them letters.
Get those cards and let us come in.
The other thing I wanted to ask about is you said you do some surgeries. Now, obviously you can't probably do some major ones, but what are some of the typical things that you will do?
Well, first of all, you know, some people come to the hospital and they have major things wrong. Of course, we're not capable of doing certain things, but we can do a very lot of different procedures like appendectomies, so on. But you don't see the ordinary cases in Africa. They're all complicated and bad. And like you have a patient needs a cesarean section, but she needed it 3 days ago or something like that.
So everything, or a lot of things are emergency.
Yes, and they have been an emergency for several days. Like if you strangulate a hernia or something, it should have been operated on. But when you consider the transportation and the lack of education and things, and then there's not always available.
So do you go ahead and do those emergencies?
We will do them if it's something that we can do. Otherwise, you know, we'll try to send them someplace. But if you send somebody to a hospital, you have to send the money. Because I don't care how sick you are, you can walk up to a university hospital in Kumasi, Ghana, with a baby in your arms that needs very sick. If you don't have the money, you just turn around and go back because they're not going to take you. And it's a long story, but that's the way it is.
And the thing about the hospital in the bush where we're going, he'll be the only doctor there, and there's no anesthesiologist either. So he'll be running around this side, you know, doing the anesthesia, then on the other side to do the surgery. So that's going to be a little tough.
He hasn't taught you that part yet?
No, that I don't do. I count
You need
pills.
to sit in his class
I don't
there.
do that, no.
Oh,
So we can certainly use everybody's good thoughts and prayers.
well, I'm sure
So-
that you have that from the Fairfield community.
Oh, yes.
And I
know
guess
we
I
do.
would like to thank you both for what you're doing. It's something maybe a lot of us wish we could do that probably never will, but maybe some will. And
Maybe we'll encourage a few to think about it anyway.
yes, I hope that maybe we've opened a door into someone's heart that they might think about this and end up doing it.
That would be a good thing.
We enjoyed having you here.
Yes.
Thank you.
Yeah,
It's really
thanks for
very
coming.
much.
We love to talk about Africa.
Can we get one shot of the elephant?
Oh, we've got to get
I'll show you the
elephants.
elephant. So Richard,
They
you'll just
do
turn around and
Yeah.
show them a wonderful elephant.
I will say that the Ghanaians, the Africans do beautiful carving, and we brought these elephants back. The big one in one piece of luggage that Jean had to sort of sew him into the luggage, and then over the years we keep bringing them back. Now we have one for each of our girls someday, but we love the elephants. But you have a lot of beautiful carvings in Africa. Don't know what kind of wood it is. They polish them with shoe polish. They don't have, it's not a stain, it's just brown shoe polish, and then they buff them till they shine,
Well, they're beautiful.
aren't they?
And it's a great work of art that you brought back.
Oh, I
that you
think
can share.
so.
Well, we wish you the best.
Thank
Thank you.
you.
And a
Thank
good
you.
trip, and a safe trip, and a healthy trip.
Oh, yes. That's
We've never had malaria.
Never been.
That's good. That's good.
That's right.
Cross your
Take
fingers.
that pill tomorrow. We start tomorrow taking the big pill.
And we will see you when you get back.
Okay.
Okay.
We'll be back in March.